Welcome, welcome. Come on in. We're going to get started here in just a moment. I think everybody knows me, right? I think so. Rick Buck. Or if you want to call me doctor, you have to call me Dr. Dick Chuck Buck. My name's Richard Charles Buck, so you got to call me Dr. Dick Chuck Buck. So don't try it. I would just advise you not to do it. But it's great to be here. I work with Feb Central, as many of you would know, and really privileged to be back as of September, and grateful to serve again in the area of leadership development. And I am here today with my friend, Greg Steffens, Dr. Greg Steffens, who was my doctor, so do not ask him personal stories about my health. But in a moment, we're going to pray, and then I'm going to introduce Greg, and we're going to launch right in to a pretty heavy topic, right? But a very relevant one in today's environment, particularly in Canada. As you'll hear, Greg's got some really interesting stuff to share and updates, and I'll be looking at a couple of things related to the biblical theological piece. Yeah, hopefully that you'll find this helpful, informative, and hopefully also helpful in terms of just, we talk about at the end, some ministry stuff. So why don't I pray, and we will just ask God to guide our time together. Let's do that. Father, thank you so much for the privilege that we have to be at this conference and be learning together. And this is a heavy, important topic. And we just are praying for your guidance and your leading. Lord, help us as we both understand and then seek to minister to a culture that has really gone far from the sanctity of life. And so we just pray, Lord, that you would help us in that regard. We want to minister effectively, lovingly, but truthfully. And so we pray that you will, this time together could be helpful in that regard. So we commit our time to you, and thank you now. In Jesus' name we pray. Amen. So Greg, as I mentioned, he's been a family doctor for 35 years. With extensive postgraduate training in palliative care, which is very helpful to what we're going to talk about today. If you will, he is a womb-to-tomb medical doc. So he was a consultant in palliative care at RVH, that's our hospital here, Royal Victoria Hospital, and previous chief of family practice at RVH. He was an attending physician for his patients at Hospice Simcoe for over 20 years and served as a board member for several palliative care advisory committees. Greg is also a good dear friend of mine. He's a strong Christian and a spiritual leader here at Emmanuel. He's served for many years. They were here before we ever got here, and we've been around for 30 years, so that kind of dates you a little bit, Greg. But yeah, so he served as an elder, and then I can tell you he serves in pretty much any capacity he can. And in fact, I saw you in the choir at Easter Sunday, so that was great, singing away. Was that Tracy? Okay, that's good. So can you give a warm welcome for Greg, and he's going to lead us in this time.
All right, thanks, Rick. You sound me too good to be true, but anyways. So thanks for inviting me on this really important topic that's relevant really to all of us, and we're going to show that. So let's get started with a show of hands. Who in the congregation crowd here has experienced or have knowledge of somebody in their circle of friends, neighbors, maybe even your church members who've chosen M.A.I.D to end their life? So, that's a lot in this kind of crowd, right? Had I asked that question 2 years ago, I'm not sure I'd see any hands. And we're going to show you why, okay? Today I'm going to be reviewing exactly what M.A.I.D is and then contrast it to palliative care. We're going to talk about the changing M.A.I.D legislation that's been introduced by the Canadian Liberal government in Canada. And we're going to also show how we're on a slippery slope on this topic in our country. Pastor Rick will then address some of the biblical principles regarding M.A.I.D and also end with how to talk to your parishioners and people you care for about the dying process and palliative care, etc. Right? So we're going to also let time for questions. So we're going to burn through this topic really fast so we can get some questions afterwards, okay? So let's get started. with what M.A.I.D is. And as you can see in the board, M.A.I.D occurs when a physician administers or provides medications at the request of the patient that intentionally brings about the patient's death. Okay, good. Do you want to do that?
Yeah, I think.
Sure. Okay. Oh, quick spoiler alert. M.A.I.D now accounts for the fifth leading cause of death for Canadians. Fifth leading cause. Yeah, shocking. All right. And the key word in this definition is intentionally brings about the patient's death. M.A.I.D really is a misnomer. It should be called, it has been called for years, physician-assisted suicide, and that's what it still should be called. All right? In this age of misinformation, when you listen to a speaker like me or read an article, you always want to look at what are the sources of the information being presented. So here are mine. Is it working? You going up? I don't think this is dialed in here, buddy.
No.
Is that the arrow's not working?
I tried the arrow.
Or?
Okay. There?
Oh, we went too far. Okay, there we go. Technology is the worst part of medicine, actually. All right, so here we go. Those are my sources. I'm not going to read them. The issue of M.A.I.D, folks, is emotionally charged because it usually involves somebody that we dearly care for. But we cannot allow truth to become the sacrificial lamb as we see changes in our society about laws and societal norms, all right? Truth has to still predominate. Do you still want to do that? As we're all aware, suffering, affects all of us. My life, your life, even the life of Christ. I've been the attending doctor, a family physician, for several hundred of my patients' deaths in hospice, in palliative care settings, in the home setting with house calls, hospitals, etc. And I understand it's not always a peaceful process, but I'm not here to romanticize death. But M.A.I.D can't be ignored any longer. So now Pastor Rick is going to read a real-life account of a M.A.I.D death. And this account was witnessed by a family physician who's actually the senior editor of the Canadian Family Physician Journal, and it was published in October 20. Please listen to how the account has been crafted to make M.A.I.D seem compassionate, expeditious, and something that you really, sounds inviting. All right, you got it?
The man requested that he spend his final days at home. His entire family and all his close friends were there. When the time came, he went to his room and lay on his bed. Each person present approached to give his or her love, and then his wife lay beside him. After confirming that this was indeed what he wanted, his final wish, the procedure began. He removed his glasses. The physician began the injection in the PICC line. It was 11 a.m. Everyone was crying. Even the caregivers were on the verge of tears. It all happened very peacefully. After the midazolam, the man was barely breathing, administering the other medications, the lidocaine, the propofol, the neuromuscular blocking agent. At 11:05 a.m., the man was dead. He had already passed away, gone to the hereafter, or to the oblivion. I do not know which, in a state of astounding calm. It was incredibly simple. It was almost mesmerizing. Watching this man pass away, I thought to myself, wow, how easy it is to die. Why endure years of suffering? Why desperately cling to life? No need to think about ending it on your own anymore. No need to rifle through your shed to find a rope and stool or a gun. Rather, enough pills or throw yourself off those who knows what. Someone else will take care of it for you in a professional manner, without risk, without suffering, without disastrous consequences, without judgment, without interrogation, without uncertainty, and with the same end result had we done it ourselves, infallibly, peacefully, so much so that it frightened me. No, not because I'm against MAID. In reality, I'm neither for nor against it. I only have questions. Always the same questions. What is life? Is life itself sacred? Can we dispose of it at will? Yes, always these same never-ending questions without any answers. Where do we come from? Why are we here? Where do we go after death? Is there an afterlife? Does life have meaning? What frightens me is how simple it is to die now. MAID definitely changes things.
And this is written by a non-Christian physician. And remember, he asked, is life itself sacred, and can we dispose of it at will? He made it seem like, you're going to take your beloved dog to the vet to be put down who's ill. It's just that kind of theoretical process, right? Okay, so you pastors that are attending like 3-point sermons, so I actually made a 3 separate kind of point presentation, but it's not going to be a sermon, saying thank the Lord for that. Okay, so it's based on the famous Clint Eastwood movie, The Good, Bad, and the Ugly, and we're going to start with the ugly. All right, I think you can go on. Right, so since 2016, when MAID was introduced into Canada, 60,171 people have been put to death. And you can see the numbers on the chart there are growing exponentially. We don't have 2024 data, but you can be guaranteed they'll be much higher. MAID now accounts for 1 in 20 deaths in Canada. And in Canada, it accounts for the highest death rate in absolute numbers, more than any other country on the planet. As a comparison, California has about the same population base as Canada, about 40 million or so, plus or minus. And they also had MAID introduced in 2016. However, in 2022, they only had 1,270 MAID deaths. And if you look at our chart, how many did we have? Like 13,000. So Canada had 10 times the amount of MAID deaths, given the same population base, same time when MAID was started. So you wonder, why is that? Like, why is Canada leading MAID, right? So I want to just give you 30 seconds to think about this question. Hit the next slide. Oh, it did. So what are some of the factors that led our society to even consider MAID? So think about that for 30 seconds. There's about probably 7 reasons. We're going to go through them all. Is that 30 seconds? Wow, okay, you really are rushing me. Okay, so the number 1 reason, and this is based on a study for applicants who applied for MAID out of the University of Ottawa Hospital in 2020, 77% of people said they were fearful of pain and suffering. And that's what they wanted MAID, right? In our contemporary cultures, collective delusions that pain and suffering produces no benefits at all. But we can all attest that's not true. 30% asked for MAID because they were tired of the disease process and they couldn't do things they wanted to do. 21% of patients chose MAID because they were lonely. A whopping 45% of patients chose MAID because they felt they were a burden to their family. And if you think about this, couldn't MAID be an easy way out for family members? If you're looking after a frail elderly person who may be with dementia, or maybe a person with severe disabilities who's taxing you in every way, monetarily wise, psychologically, every way. It'd be an easy way out for family pressures to encourage the MAID process. And how about societal trends? What does our culture value? Independence, strength, happiness, wealth. And we all fight against aging. What about money? There's definitely a cost saving when MAID is done for family and the government for certain. They did a study in 2023. They polled Canadians and they asked, would you agree that people who are poor or homeless, should they be allowed to have MAID? They weren't sick. They didn't have any terminal disease or anything. They are simply poor or homeless. and 27% of Canadians said that that would be okay with them. And we all know we live in a secular society, postmodern godless worldview, where the inherent dignity of a human life is lost. We say things like, I wouldn't let a dog suffer like that, so how can we let a human suffer like that? And be certain that our government legislation will determine the moral choices that our society makes. And we can see this in what happened during the Trudeau reign when M.A.I.D was introduced. And now we're seeing these numbers. And now, they actually did a study last year, and they polled Canadians again, and they said, do you agree with the current law of M.A.I.D? And 74% of Canadians in 2023 said they agree with the new M.A.I.D laws. So our whole culture has shifted into a M.A.I.D acceptance. Rick now is going to talk about the whole issue of autonomy. Can we show that? Yes. So good old Frank Sinatra sang it. I did it my way. And this clergy person, I think you have to go up.
I tried that one.
There we go. She says bodily autonomy is sacred. Okay.
So we're just going to talk briefly about the autonomy piece. And it was interesting. I read another Canadian hospital study that reports that those who received medical aid in dying tended to be white and relatively affluent, and indicated that loss of autonomy was the primary reason for their request. And of course, other reasons were identified, as Greg said, burden to others, not being able to enjoy life, and those kinds of things. But few identified actually, managing pain as the primary reason for that. So this has been talked about in many studies, that this sense of independence and autonomy, which is huge in the West, right? Here we need to be able to minister to people. We need to be able to answer some of that. And my suggestion to you is, one of the things we need to say is that physician-assisted suicide, ironically, brings any freedom that we may have as individuals to a screeching halt. For the same reason that we don't encourage suicide, so we shouldn't encourage M.A.I.D. And I know there's a distinction between M.A.I.D and suicide. I recognize that those of you who are maybe in the counseling background, suicide is often done very privately and can be violent, et cetera, et cetera. But the principle that I'm getting at here is important. We should ban assisted suicide for the same reason we ban slavery, which is it's the antithesis of personal liberty. We don't let people choose to become slaves. When people are vulnerable because of suffering or disease, it's neither wise nor loving to enable people to do further intentional harm to themselves. And that's kind of the point we're making here. The goal should be to support them physically, emotionally, spiritually in their suffering, not to end whatever quality or measure of life that they still have. And of course, we know that God has given us a measure of personal freedom. We see that in the Garden of Eden. And we see that today in various ways. We see it in the medical context through informed consent. There's aspects of liberty and freedom given to patients. But we need to recognize that true freedom, especially for humans, is always within healthy limits. Absolute autonomy, or that kind of freedom, is neither something we are possessors of or capable of. Only God possesses that, and only God is capable of that. And that's why our true freedom is always, always to be discovered under God. Under God, true freedom for all of creation is to live within the limits He made us for. So the easiest illustration that I like to give when I talk about this area is just take a fish, for example. A fish is free in the context of water. Now, it could be absolutely free out of water, but it would also be what? Dead. So there's a kind of freedom for which we are made for, and there's a kind of freedom that's self-destructive. And we all know this intuitively, and I think talking to people about that. Our friend, both Greg and I's friend, pastor friend, he used the illustration of an astronaut doing a spacewalk. And, they're up in space, but if they're severed from their equipment, from their lifeline, from the oxygen, from their suit, they're absolutely free to go on a spacewalk, but they're also going to die. right? So we get that humans don't have capacity for absolute freedom, and that's why this is important in this case. When we live within the limits of God's commands and precepts, we know this from the Bible, we flourish and we become all that God created us to be. But when we attempt to live outside of his will, we die. And you can think of the first sin in the Garden of Eden, when Adam and Eve stepped outside of God's limits. The temptation was to be free, to be independent, to finally, be in charge, if you will. And instead, what happened? They died. First they died spiritually, and then they died physically. Absolute autonomy, where I become God and decide on what is good and bad and determine my limits in an unlimited way, will not bring our liberation, my liberation, your liberation, or any of our liberation, but our enslavement and our destruction. So that's what we need to be able to talk to people about when it comes to autonomy.
Thanks, Rick. And that choice was made by 37% of patients alone. Yeah. So the results of all this kind of thinking has changed our way of looking at end of life. And now we're using terms like, can you advance that? Terms like death with dignity, which implies that M.A.I.D is somehow inherently preferable because it allows a patient to die with dignity, and that now a patient death with good palliative care is somehow less desirable without dignity. And of course, this is a blatant falsehood. It's a lie, right? And we're going to show that. Another term used today is the right to die, which is another misnomer, because M.A.I.D advocates use the term right to die, but we all have the right to die. Many of my patients, when they're diagnosed with terminal illness, they'll say, well, if it's going to be that bad, I don't want to have aggressive chemotherapy. I don't want to be put in a ventilator. I don't want to have an artificial feeding tube placed. So they have the right to die. They have the right to choose when and what kind of treatment measures they choose. M.A.I.D advocates should really be using the term the right to be killed. But that sounds too harsh, right? It's offensive. So anyways, we're moving on now, and we're going to find out what happened with the government. In 2016, the Parliament of Canada passed federal legislation, Bill C-14, and you can read it. It says, allowing any consenting adult can request M.A.I.D who experience intolerable and enduring suffering due to a grievous and irremediable illness, disability, or disease where natural death was reasonably foreseeable. So when you look at this definition, I have three concerns about it. The biggest concern for me is what about the consent issue? So how many of us, if you were diagnosed with a terminal illness, and heaven forbid that happens, most people don't even hear what the doctor's saying. They just blank out, right? And they have to come back multiple times to really get the information. And can they even understand all the treatment implications of their diagnosis to make an informed consent, right? Most patients are very vulnerable, and they trust their health provider. I mean, I've had patients multiple times say, well, Dr. Greg, I trust you. What would you do? But what if I was for M.A.I.D, right? And in November 2024, in Nova Scotia, a lady was going for preoperative assessment for localized breast cancer. She was approached by two physicians in the pre-op phase telling her that M.A.I.D could be an option for her future care. So she had localized breast cancer. She didn't have terminal disease.
Tell them what that,
Yeah, so she is probably stage 1 or maybe stage 2, but the point is she wasn't terminal. She was just going for mastectomy, right? And she was offered M.A.I.D for future treatment measures, showing her bias, right? It's horrific. And the term intolerable and enduring suffering, that's subjective. It's determined solely by the patient. So let's talk about an example that we all know, Johnny Erickson Tata. We know her story. Beautiful 17-year-old girl, tragic diving accident, quadriplegic. She wrote in one of her books, "Why on earth should I be forced to live out such a dreary existence? How I prayed for some accident or a miracle to kill me. The mental and spiritual anguish was as unbearable as the physical torture I was enduring." So think about this. She could have been a M.A.I.D casualty. And now reflect on all the benefit that she has done to help people who are suffering and she honored God in the whole process, right? The term irremediable illness means incurable, but the Supreme Court of Canada didn't request the patient to have a treatment course. And finally, there's no mandate for a palliative care consult prior to a M.A.I.D death. So let's go ahead and look at the criteria for M.A.I.D. They're just outlined there pretty easily. Some of you might have a morbid curiosity about the details of the M.A.I.D process, so we're going to review that quickly too. 2 IV sites are established by a nurse. 30% of M.A.I.D deaths occur in the home, so a visiting nurse and doctor will come. 30% in hospital, 3% in hospice, and a few in long-term care. That's the kind of basic breakdown. So the drugs are given, as they're outlined there. And on average, in 5 to 6 minutes, you're dead. It's that fast, just like the account that Rick read. Okay, so we're going to move on to the ugly. That was the bad. Now we're going into the ugly. So if you ever, went to the top of an icy hill and you took one step down, you're committed, right? So this alludes to the slippery slope philosophy, which we are all entering as a society in Canada with M.A.I.D. And I'm going to show you how that's playing out. So there used to be a 90-day approval for M.A.I.D applicants, then it went down to 10 days, and now there's no time restriction at all for M.A.I.D. Now, I have to qualify that, and we're going to talk about the Track 2 application later. If a Track 2 application, there still is a 90-day, but hardly anybody has a Track 2 application on M.A.I.D death. Okay, so the next slide. Another serious slippery slope happened in March of 2021 when Parliament again revised the legislation with Bill C7, which removed the term where a natural death was reasonably foreseeable. So now M.A.I.D can be done. You don't have to have a terminal illness. You can have a chronic illness like Parkinson's or chronic pain, or you can be Johnny Erickson Tada, or there's one death recently for post-COVID syndrome. So, you just pick and choose, and you just get 2 doctors to decide, okay, yeah, I guess you qualify, and away you go, you're done. It's interesting that last month, the United Nations Committee on the Rights of Persons with Disabilities called on Canada to repeal this law. Yeah. And you know what they said? This isn't documented. I have so many documents. If any contest anything that I'm saying, please come. I can do battle. But listen to what they said about this. They're addressing Canada. They say now M.A.I.D in Canada is now seen as a solution to their intractable living situations and is a state-sanctioned relief from suffering for people who are failed by the governments that don't properly fund access to health care. Yeah, it's frightening. So this is all about funding. It's not about compassionate deaths. This is just about funding. If that wasn't concerning enough, it gets uglier. In March of 2023, again under the Liberal government's initiation, we became one of the first few nations in the world to allow M.A.I.D for people with a mental health disorder. Now think, in a room this size, I'm guessing, I don't know how many people, 60 or so, whatever. So perhaps 12 of you have suffered depression in this room, if you look at the numbers. And when you were deeply depressed, did you have hope for your future? Did you, when you're laying at night in the dark room, did you not think sometimes, oh man, I wish I wasn't alive. I wish I wouldn't wake up, right? So when you're depressed, your mental faculties aren't all there. You really can't consent to M.A.I.D when you have a mental health disorder, okay? And most psychiatrists would say that, mental illness is never incurable. There's always a hope for cure with different therapeutic trials, more psychosocial counseling, and other social factors. You can get better. Fortunately, this legislation has been temporarily delayed until 2027. Just for your information, it's too late, but Pierre Poilievre said if he was to become Prime Minister of Canada, he would not let this legislation go through. But I have no idea where Mark Carney stands on this. But if you have a chance to speak to any Liberal representative, you have to push for this not to go through, because this would be horrific. Now organizations like Death with Dignity, Canada, the Right to Die Society, and others are petitioning lawmakers to consider MAID eligible for mature minors, that's young people under 18, to honor advanced directives for people with dementia. In the Netherlands in 2020, Dutch legislators have extended age eligibility for kids under 13. This is a frightening one. In Quebec, the president of the Quebec College of Physicians is now exploring the prospect of euthanizing newborn babies with severe malformations or grave syndromes, saying, "Suffering has no age limit." He's quoted saying, "MAID is a form of care, a medical act. It's not political, it's not moral, it's not religious. It's a medical issue." Moving forward with this depressing talk. Regional funding of hospice facilities across the country have been cut off if they don't provide MAID. And that's true for Simcoe County as well. And as we speak in St. Paul, Vancouver Hospital, which is a Roman Catholic faith-based public hospital in Vancouver, of course, they're being sued by Dying with Dignity Canada for not providing MAID. And it's going to trial in 2026. And again, it highlights the battles being waged for MAID, the MAID agenda to be propagated across our country at many levels. Now we're having MAID perform in churches, and Betty apparently was put to death with songs like How Great Thou Art were sung and that sort of thing. In Basel, Switzerland, there's a group called Pegasus, and it's a MAID facility, and you can go there for any reason. This is like called death tourism. For any reason, for 10,000 euros, you can be put to death, and that includes cremation and shipping your ashes home. And now actually they're building suicide capsules in Switzerland that are in process of being developed. The fascinating thing about all this, and this is the last of our ugly slide, is that the British Columbia Civil Liberties Association, they initiated the lawsuit that led to Canada adopting this bill, C-14, allowing for MAID. But in 2024, I have an article right here from the National Post, which is my favorite read. In December 24, she says, we have gone too far. And they're the ones that advocated for MAID. And now if you look at the note, the quote, she says, we're aware of concerning reports of people being offered MAID in circumstances that may not legally qualify. All right. So now we're going to get to the good. So a Canadian coalition of faith groups in 2021, including rabbis and Christian denominations and imams, denounced MAID and instead endorsed palliative care. So that's where we're going, and that's where we're going to hang our head on for the rest of this discussion. So what's palliative care? There's the definition according to WHO. It's important to know that palliative care provides medical assistance well before the dying process. Many people in the community think that palliative care starts when the person's like gasping and the doctor's calling for morphine. That's not good palliative care. Like that's end of life kind of treatment, and that's important. But so palliative care should start when your person who you're caring for has been diagnosed with a terminal illness. At that very onset, they should get a palliative care consult to start the process. All right, involves, not just doctors or nurses, but social workers, clergy like yourselves, family, neighbors, volunteers. It's a really comprehensive care. It's active care, and it's not just symptom management. It's based on compassionate and knowledgeable treatment of the patient. So let's ask the question, what are the challenges for a patient and their family members that come up when faced with a diagnosis of a terminal illness? So I'm going to give you a 30 seconds. In Rick's case, he's probably 5 seconds. So, yeah. So what are the challenges if one of your loved ones has come up with a diagnosis of a terminal illness? What are you starting to stress about? All right, long enough? Oh, right up. Okay, so timing. So, most of us die over weeks, months, sometimes even years with chronic illness, like chronic renal failure, liver disease, dementia. Only 10% of us will be blessed with a heart attack or a stroke that suddenly takes our life, right? So most of us will fall into this category that we're going to be needing palliative care. A lot of patients and families don't accept the diagnosis. They haven't really come around to terms. Some families will argue amongst themselves about treatment and should mom have a DNR order in place, or should we do everything we can to keep her alive? Symptom control is a huge one, right? And I'm going to just move ahead to our dear friend C.S. Lewis. Can you hit the next slide there? I think he's up there. So C.S. Lewis in The Problem of Pain, which is a fantastic book, he says, God whispers to us in our pleasures, speaks in our conscience, but shouts in our pains. I love this next one. I'm a great coward. If I knew any way to escape pain, I would crawl through the sewers to find it, right? So who wants to suffer? I mean, I would want an anesthetic for anything that I'm having done. But the reality is that, there's difficult symptoms that palliative care physicians have to manage, like shortness of breath, intractable pain, confusion, seizures, bleeding, depression, right? But with expert help, most of these things can be really well managed if you catch them in time and you get that palliative care consult going early on. I know some of you have watched a loved one have a really tough time end of life, but it doesn't have to be that way, right? The real thing that you need to understand, even in the worst case scenarios, you'll say, oh, you know my story about how my dad died. He was in so much pain. Well, now we can put patients to what's called palliative sedation. So the real challenge with pain control is kind of walking that tightrope for pain control and sedation, where they're kind of unconscious, right? So you're not talking, right? But somebody in tractable pain, you can actually sedate them so they're not suffering, all right? So nobody has to die in a horrific death. And the goal, even with doses of morphine as they're escalating, those doses are not killing the patient. They're just treating symptoms. Whereas the doses for M.A.I.D are instant death here and now. They're lethal doses. So, and the intent then is to cause death. Our intent as palliative care physicians is to relieve suffering. And we're not causing death. We did a talk, Pastor Steve Paulai did a talk last week to their church group on this topic. And one fellow said, I was told that by two doctors that my dad, when he died, the morphine caused his heart to stop. Well, that's not true. Morphine does not cause the heart to stop, all right? So you just have to check what's really being said here. Where are we, Rick? Oh, yes, nice. So this is kind of the last section. Rick's going to go at it then. Okay. Oh, you know what? We skipped one thing that's kind of important. That's okay. What we skipped was access to palliative care is a challenge. And only 50% of Ontarians can have access to palliative care, and it depends on your postal code. So if you're living up north in some community where there's not a lot of services, you may not get a palliative care nurse or a doctor that can really look after you. And then you might even consider transfer to a hospice that's locally that's an expert. And some palliative care physicians are more centrally based in hospitals and larger centers, and the doc who's running the one doc show in one town, he may not have an expertise in that area. So, it really depends on funding and access. I think we hit them all then, eh? Okay, so now we're into the good. And so there's lots of good things that can happen with palliative care, right? With expert, as we talked about expert help, you can have some peaceful passing in the home. And I don't know if you know, but say you're caring for a loved one and the doctor and the nurse aren't around and there's a pain crisis, you can have a tackle box full of medications. It's called a symptom control kit. And you're trained on how to use these different meds, and you can self-administer those medications to your loved one in the home with the whole goal of relieving the suffering in that acute time. And then you call the PSW or the visiting nurse or whatever, say, hey, I just did this, and they might come by and have help too. So you're not alone, even in the home setting. But I must say, if this doesn't sit well with you, hospice is a fantastic option. And really, I love the work that's done in the hospice setting. As clergy, because I know there's a number of clergy and church members here who do visitations to people in hospice and hospitals, you can help. Praying for them is for certain so helpful, but you can do practical things. You can help position the patient. You can help with mouth care. A lot of people, when they're passing, they feel so thirsty, and you can help with mouth care. You can set up a music playlist. You can put a fan on their face just to make them cool. There's some studies that show that people with ALS or people who are having trouble breathing end of life, if you put a fan on their face, they reported less breathing difficulties with just a simple fan, So there are practical things that you can do as clergy in this setting to help the patient's comfort. Another real benefit, of course, you've seen probably, is the reconciliation with God and with family members during a death. Families often reconcile in that palliative care process, right? And I had one patient named Gary. He had end-stage metastatic colon cancer, and he was in hospice under my care. And his family brought in this portable keyboard. And this dude, he played worship songs for the staff. And so he was a great testimony to the staff. He demonstrated his Christian love for the staff and honored God in the whole process. And it was beautiful to watch. This next slide I can barely get through. But that's my mom in her happy days and my daughter. And then end of life, she started getting advanced Parkinson's dementia. And here's my daughter saying goodbye. It always kills me. Anyways, the point of this slide, though, is that this sort of death allows for a normal grief process. And I can tell you that I even have a medical colleague that I know very well, and she was my patient as well. And her father, who was an internist, decided against her wishes and the family wishes to have M.A.I.D. And now this medical doctor, who's a colleague of mine, is struggling with the fact that she didn't go through the normal grief process. And now there's actually wrongful lawsuit deaths for, that initiated by family members who some person in the family said, yeah, I just want to end my life. And they went on and did it with the family's approval, right? So this is a really normal grieving is an important part of the dying process. Okay, so you've noticed I haven't said a single word about the Bible. And that's intentional because you folks should be able to talk about palliative care and M.A.I.D. without using the Bible verses. You should be able to advocate for that. But we're Christians, and we got a pastor here.
So we are going to briefly talk about just scriptures, and probably part of what I'm going to do here is just for most of you is just remind you of things you already know. But I think it's good to anchor this, and I think it does give you some points of discussion, and I'm going to recommend a resource for you that can help you discuss this from a general revelation perspective without any of the Bible verses. So a lot of what I'm going to talk about is actually something you can talk with your neighbors and your people with in terms of just these are basic ethics and points you can be made. So first is just a couple of verses here. Genesis 1:27, so God created mankind in his own image. In the image of God he created them, male and female he created them. And then Psalm 139, for you created my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. And so what we're underscoring here through these verses, and obviously there's whole passages that you could turn to like Psalm 8, every human life has intrinsic value, not extrinsic value, because they were specially created by God. Extrinsic value is that value from without that, someone gives to you or gives to that. You could talk about something like your iPhone, right, or your smartphone. And it's functional, you use it, you give it extrinsic value, but when you're done with it, it's replaceable, right? It's not irreplaceable. So we can talk about things that matter in our lives, but only people matter absolutely, not conditionally. And the Bible's underscoring that here. Human beings, man and woman, are the pinnacle of God's creative work in Genesis 1 and 2, and uniquely reflect and represent the glory of God, bearing his image to the created order. They are priceless and irreplaceable. Everything else is replaceable and can't be identified as priceless. They were placed in the garden to enjoy fully the life God created them for. And this underscores the sanctity of every human life as the precious, gracious gift of God. And we'll talk about that in a few minutes. That's why, M.A.I.D is so such an affront to God, because he's the one who created us. Genesis 1 and 2 also is telling us that death is not God's intention. It's an unnatural intrusion into his good universe. We know this. The gospel of Jesus Christ is telling us the story, is the big story, the meta-narrative telling us how God makes a way out of the death and curse of sin that has been brought about, that happened in the Garden of Eden. The good news is all about God's rescue mission that seeks to return us to the eternal paradise that God created us for. It was lost because of the entrance of sin and death into the created order, and God's plan and promise is to reverse that spiritual and physical death. The goal is the full and total deliverance of God, conquering the enemy of sin and death through the atoning sacrifice of Jesus and the resurrection life given to us through Christ. God's love in Jesus saves us ultimately from every aspect of the curse of sin, from its penalty, from its power, and ultimately from its presence. So there's Ewan Gallagher, who's a University of Toronto professor, also a critical care doctor, has written a book, and I'll be mentioning this or showing this to you in a minute. He writes, "Indeed, this love, the love of the gospel, comes to us in spite of our lack of usefulness to God, in spite of our failure and inability to adequately worship and glorify him. The gospel reminds us that we have deep, incalculable, inherent, and intrinsic value," right? What we're saying here is that M.A.I.D is based on the premise that our lives have conditional value based on our level of function and performance, on its utility for others or for ourselves. But God is saying to us that our lives have intrinsic value no matter what our capacities are or capabilities. And this is why, for God, infants, the aged, the healthy, the sick, the poor, the wealthy, the male, the female, the black, the brown, the white, are all equally valuable to God. We can't independently from God decide on the value of one life over another, nor can anyone else, nor can we decide that for ourselves. Each life is his, it's treasured by him, and that leads really here to our second point. And I just share these verses with you. You shall not murder, Exodus 20:13, Genesis 9:6, whoever sheds human blood, by humans shall their blood be shed, for in the image of God has God made mankind. So here I just want to say what this means, particularly what we've said about the intrinsic value of life, particularly in terms of our discussion of M.A.I.D, is that the unlawful taking of life, the intentional taking of life, including self-murder or any intentional assistance in taking the life of another, is wrong, morally, ethically wrong. We are talking about the deliberate act here of taking a life rather than enabling, or through either enabling a patient to do so, which my understanding is that would be physician-assisted death, if you will, and then euthanasia, where the doctor actually does it themselves. From the Bible's perspective, any intentional taking of life is considered an attack upon the glory of God that's imprinted on every life. And this is speaking again about the high value of human life in the midst of the created order. In this sense, it's a big deal to God because it's an attack upon his good and gracious gift To not treasure what God treasures, no matter a person's capacity, function, or performance, is really an affront to God. And biblically, we know that God gives special recognition and protection to those who are vulnerable, both spiritually and physically. They must be given special care, special compassion, including protecting them from themselves. When you think of children who don't have capacity, or anyone in any place of vulnerability, should be handled very, very carefully. All our counselors in this room know how critical this is. And just, so children, the elderly, the infirmed, the mental health issue, those with special needs, anybody who's vulnerable in any way. So this leads us finally to just a couple of other texts. This is Job 1. At this, Job got up and tore his robe and shaved his head. And then he fell to the ground and worshiped and said, "Naked I came from my mother's womb, and naked I will depart. The Lord gave, and the Lord has taken away. May the name of the Lord be praised." Here's another couple of verses. Your eyes saw my unformed body. All the days ordained for me were written in your book before one of them came to be. And I love Acts 17:25. And he is not served by human hands as if he needed anything. Rather, he himself gives everyone life, breath, and everything else. Grace. Every breath. Right? So God alone is absolutely autonomous. And the reason he alone is sovereign in everything, in life and death, is because he alone is the creator of life. He alone is the giver and the sustainer of life. And he alone is the taker of life. He alone gives physical and spiritual life, and he alone is the judge of that life. None of us have capacity for that or have that role. And as a giver, he has the right to take. We also have to come to terms with that, right? You and I don't have the right because we're not the author or the creator of that life. Job knew this, and he understood this about life, and that God is the owner of everything, and all suffering comes through God's hands, including seemingly unjust suffering. He didn't have to like it, he didn't have to want it, or even understand it, but he needed to trust God in it. And that's the wrestling of the book of Job. That's how he goes on that journey. And moments he's doing great, and then he's not doing so great. And while we may not understand the beauty yet brokenness that marks our fallen world and our personal lives, most times I think we do not, the solution is not to seek autonomy from God in that. Instead, our deepest need is in faith to grieve and then to grip more tightly to God. I sometimes have asked pastors, or people that I've pastored, think about anyone that you can think of who's gotten better by running away from God. And then think of people, Johnny Erickson Tata, might be an example, who, like what you can bear with God, right? It's unbelievable, right? So I suggest that we are like little toddlers that don't have the capacity to understand the ways of an adult, but in their pain, these little children loudly cry, at the same time clinging to their parent, to the one that cares for them. In a similar way, we're like that. We're like, God, it hurts, but I'm not leaning away. I'm leaning in to the Heavenly Father because it's the only safe place to be in our unanswered questions. So the answer is not usurping God's authority. The answer in the mystery and the unanswered questions, particularly as a believer, is to become more dependent on God. Our lives do not belong to us, and every time we seek to autonomously go our own way, do our own thing, it doesn't end up well. We were created by God and then given eternal life at the cost of the sacrifice of his Son, his one and only Son, and we are not our own, but we've been doubly bought as Christians, right? Bought at a price. And our bodies are not our own to dispose of as we see fit. Think of 1 Corinthians 6, 19 and 20. We don't live and we don't die in our own terms. So this brings me to the end of my point here. Trying to take God's job or act like we have the capacity to do his job will only spell disaster for humans. Asking our doctors to assess whether a life is worthy of living and who should live and who should die, or trying to determine this for ourselves, is the height of foolishness. Doctors are too small. I know that. He's my doctor. I knew, and he was always good. I don't have all the answers, right? And they acknowledge that. Here's what we do know, here's what we don't know. And their limits are too great. Their capacity is too fallible. And under the strain of illness and pain, we are even less capable, as Greg has so well pointed out, of making such decisions, right? So it is beyond doctors and our pay grade to make such determinations. The answer really is to stay in our lane. What is our lane? Our lane is to be distributors of God's grace and love. We are to receive and then share God's love in Jesus Christ, His mercy, His compassion that's so unbelievable. We are to receive it and then share it with each other, to those who are suffering, to those who are dying, right? Gospel love and hope is the answer, and the clearest expressions of that love is walking alongside the suffering and the dying through the gifts of palliative care, through personal care, through pastoral care, right? Autonomy doesn't work. Absolute autonomy for us puny little humans who know so little, control so little, and make so many mistakes. Once we give the permission to kill, to avoid suffering, as Greg again has pointed out so well, the limits will not stop at the terminally ill. It hasn't stopped. It's an incredibly slippery slope. Ewan Gallagher, he writes this in an article, and I'll mention this. He says, I do not write in a spirit of harsh condemnation. Those who offer M.A.I.D, some of whom are my friends and my colleagues, are those who choose M.A.I.D, and those who choose M.A.I.D are groping for a solution to the brokenness of a world apart from God. It is a very broken world, isn't it? And in some respects, they know not what they do. So this should help us, especially, we should be tougher on Christians who are choosing this than we should be on non-Christians. We should be very compassionate and merciful with non-Christians, I believe, even as we speak the truth about these ethical issues to our political people in power and decision-making, right? Yeah, that's right. Yeah, with gentleness and respect, but giving a hope for the reason. Yeah. Yet the glory of God in the face of Jesus Christ, he says, gives faithful Christians a clear vision of human value and of life's true meaning that makes M.A.I.D seem unnecessary and even foolish. Having seen that glory and that vision in the cross of Christ, we cannot turn away. And I think that's a great quote. So what do we do personally? So here's just going to run through a few things here. So I think Greg has kind of alluded this. Have family conversations. Talk to your spouse. Talk to your family. Talk to your doctor about end-of-life issues. Advanced care directives, right, Greg? I mean, you can, whether it's in your will or, I mean, you can have a whole discussion here about power of attorney and advanced care directives. I like advanced care directives personally. Make a will with advanced directives with an assigned POA. Have a discussion about this issue with friends and neighbors. Bring this, it's happening. I think some of us sometimes Greg's doing reading all the time, getting the updates, but we kind of, like, I don't know about you, but I've kind of buried my head in the sand. I don't want to know. It isn't a very nice thing to talk about. But there's some scary stuff going on, and it's just kind of like slipping under the radar, right? It's just like flowing along here. So having open discussions about this, I think, is important. Pray for lawmakers in our nation. We need to pray, obviously. I hope you voted. It's too late now, but I hope you expressed that incredible freedom that we get to participate in the process. Speak out against this injustice. I agree, absolutely. I think especially to the power brokers of our culture, not so much the people who are choosing it. I would say many of them may be ignorant. I mean, you may find someone who isn't. You can have that discussion, but I would say, especially to the power brokers, champion palliative care. You've heard Greg say, 50%? Did you say that? 50% of our, have access. So we need to advocate for hospice care and palliative care and in our communities. And I think who better to do that than people in ministry, right? And so I think doing those kinds of things. championing palliative care over M.A.I.D. Greg has watched, and I've watched, the Fifth Estate episode in January 2023 on YouTube, and the mess that is made. It is an eye-opening, and it's, you know, it's not from a Christian perspective. So I would say those are good things. So those are some things on the personal level. Let's see. And on the ministry level, read and study about the sanctity of life and end-of-life issues. I don't know if any of you have read articles or books, but I would encourage you, if you have not, it's time to do that. Start reading. Greg mentioned, I think you said to me one time, the National Post has the most stuff about this and addresses it, and it really does take a more objective approach in that regard. Preach and teach about these issues. I don't know how many of you have ever done a sermon or a lesson or a small group discussion about these kinds of things. But get informed, get empowered, and then let's start preaching and teaching about these end-of-life issues. Very important. As spiritual leaders, advocate for palliative care in your communities. Again, I think I've already mentioned that one. And then pastoral care, ministry, and decisions. You've got some decisions to make. Greg and I were having a discussion about a pastor that you know of, I guess came up in your last, presentation, about a pastor that actually attends these with the hopes that the person will change their mind in the end. Yeah, he's in the room. Now, I couldn't personally do that. I know we talked about it, and I know Steve probably couldn't do that. I'd feel too much like I'm enabling, maybe, but his approach was for the reason of maybe they have a hesitation and they have second thoughts, something of that. So you've got to do that. Here's another one for you in ministry, particularly. What if someone had M.A.I.D? When I was sick, I worked for a funeral home, and I remember my boss telling me, "We've got to pick up at 4:20." I was like, 4:20 at a home? You know what it was, right? 4:15 or 4 o'clock death, 4:20 pickup for the funeral home. But there's going to be people that you're connected with the community, connected even with your church, maybe someone even in your church. I guarantee you there are some people in your church, really what we're talking about right now, and you're going, and they're going, I think that's the best way out. With my own father, who had become a believer near the end of his life, he said, "Rick, I want this over. I want it finished." I said, "Dad, I can't do that. I can't be a part of that." So I had to have those discussions with my own father, right? So, and he was a professing believer, fortunately, but he was in a place in his life, he had lost perspective completely. He was completely disoriented. So in some ways I wasn't shocked, but as a pastor, but as a son, I was like completely blown away. So you've got some decisions. Will you do the funerals of someone who's done M.A.I.D? How will you minister to the people who family members have done M.A.I.D, as Greg has mentioned, and maybe the whole process of grieving has been circumvented, etc., right? You follow that? So here's some resources. You may want to take a picture of this, but we mentioned Ewan Gallagher, really, really great book. That's the first one there, How Should We Then Die? And he's a university prof at Toronto. He is a critical care, strong Christian, great apologetic, and most of this book, actually, he addresses this from a general revelation perspective. In other words, a lot of the material here, you could have a conversation with your neighbor and discuss that. Now, fortunately, he takes it all the way and starts with general revelation and then goes the way the ultimate answer is the gospel. It is Jesus Christ. It is God. But he begins the discussion about intrinsic versus extrinsic value and makes that case and does a bunch of things in that regard. But excellent book. You may want to pick that one up. Here's one, Between Life and Death, by Catherine Butler, who's an MD. And this is end-of-life medical issues. Like, what kinds of things, throw out a couple things that you might have to consider end of life if someone's artificial feeding. Yeah, pain management, yeah. Yep.
I forgot to mention that, say one of you are at bedside and maybe the nurse is not there and you're with the family, and then a moment of crisis happens. Just a practical tip. In hospice and also in most hospitals in the palliative care wing, they have something called standing orders. So if all of a sudden the person you're caring for starts having a seizure or starts having intractable pain or shortness of breath or an anxiety attack, there are standing orders that a doctor doesn't have to be there to give. And they're written, and it's actually part of the admission process, and I sign off on them. So just say acute seizure. We have orders to give medications, sub-Q, to help control the seizure. Or sudden acute pain, we can adjust the pain pump. Or shortness of breath or anxiety, you can give them a lorazepam, right? So there are orders. So don't feel like, if you have a fear of being bedside when crises happen, you can say to the family, hey, you know what? Because they might even know this. You can say, you know what? Your mom can have some medication because there's standing orders in place for her. So encourage her then to speak to the nurse, and the nurse will come right there, right? So it's just another practical way as visiting clergy and church members, you can really help in the palliative care setting.
Yeah, and my dad, again, referring to my dad, he had kidney dialysis at the end because we didn't know he was actually terminally ill. So we tried it. It wasn't effective, but we decided after that not to have any more dialysis because it wasn't improving his situation. So, those kinds of end-of-life wrestling and sorting through those things and having those advanced directives, if it's reversible, that's one thing. If it's terminal, and you may choose to forgo, as you said earlier, certain treatments in that regard. So We Shall All Be Changed is really a book about ministering pastorally and compassionate care as a believer to someone who's dying. And that is such an important piece, is walking with them. And then the last one is Johnny Erickson Tada's book. I don't know if I have that one up there. I guess I didn't. Johnny Erickson Tada has a book called When Is It Right to Die? And then there's this online catechism for Christians, quite long, but you can see it there. There's a link there for you as well. So I know we've got a couple minutes for questions, so let's open it up for questions.
Sure. Oh, that's a good question. So DNR, basically, with the DNR, it's something you ask for in advance. Say you've had some prior medical illness and you have maybe a grade 4 ventricle, your heart's not great, and you're going to have some kind of massive heart attack sometime, right? You can write you can do it in a will. It's called a living will, and you can tell your family, if my heart were to stop, I were to collapse, I do not want CPR, I do not want to be ventilated, I don't want to be shocked, okay? And the reality is, in that context, 99.9% of people don't recover once they're put on a ventilator anyways. So actually, it's very invasive, and it's painful. Having CPR, I've done CPR on people's chests. I think probably you have too, Josh. And you're breaking ribs on old ladies, and it's just miserable, and it's awful, and nobody benefits, right? So that's what a DNR is, sir. So you're not telling people, kill me, but you're saying, if I have a severe, say what? Yes, and it pertains strictly to CPR, intubation, and ventilation, and shocking, okay?
Difference between not receiving treatment and intentionally killing someone.
Right. So whenever I would do a house call on a person with palliative care, end stage, whatever, we would put an orange sheet on the fridge, and it would say DNR. So when the ambulance come in, for whatever reason, because a lot of people panic when somebody finally dies, they'll call the ambulance, even we're told not to. They're supposed to call me. The ambulance will come in. If they see the orange sheet on the fridge, they will not resuscitate. If there's no orange sheet there, they're going to go at it. And then everybody's like, no, Granny didn't want that, and it's horrible. So a DNR is very important in the living will, and I would say that's something that you should strongly think about depending on your age and your health status. Sir? So the bill has fortunately been put on hold until 2027. So thank God, literally, that bill has not been passed. And we can hope and pray it never will be passed, because that would be horrific for our society. Another great way to get rid of, people with schizophrenia and bipolar and all the people that make us uncomfortable. Yeah, so it's a fascinating question because, before this MAID legislation came into being, if you came to me, if Harry came to me and said, Greg, I'm really struggling with depression. I've had some thoughts. I got a rope in the back shed. I think I'm going to hang myself. I would be obliged legally to refer you to the hospital under a Form 1 application, have you admitted against your will. I would be legally obliged. If this mental health comes through that you're suggesting, sir, I would be legally obliged to refer somebody for a MAID death. Like what? Like what am I doing? I'm trying to save a life and now I'm trying to kill a life. But I'm not obliged to provide MAID. I don't have to provide MAID. I have to refer. And, I've had discussion with a few patients, and the patient has said to me, well, when the time comes, I want to be referred to MAID. And I just say straight out, I'm not doing it. So find another doctor to do that for you. Because I don't really care what the college does, because I'm old and semi-retired anyway. So what are they going to do? But that's true for abortions too. It's true for gender allocation. It's true for a lot of medical things. So it is very difficult. I would say get in there and get your hands dirty and speak out against it. Yeah, we need more Christian doctors. Scott. Yes. Yes. Yeah, so there's a really disturbing story, and this is a lawsuit coming out of Toronto where a man was in the psychiatric unit in a Toronto hospital. This is a true story last year. And he was unstable psychiatrically, but he had chronic back pain. But they gave him a day pass. And during this day pass, he went to a MAID provider, and the MAID provider put him down, killed. And the family now are contesting, and they're actually trying to sue the MAID provider because they think it was a wrongful death because he wasn't really truly able to consent. But he was put down with the guise of his chronic back pain rather than they skirted it in that way. And all you need is two doctors. And if one doctor doesn't agree, then they can doctor shop for another person who has more leniency that way, right? So there are a number of MAID deaths that are occurring that are really highly questionable. But the point to think about when you're talking to family and friends about this is that, we all think that ALS is the worst. And, oh, man, ALS is the worst. It's a horrible disease. It's protracted, it's shortness of breath, and your brain is all there. It's horrible, right? And if you start thinking, well, maybe for ALS, I'll accept MAID. And this is where our society is going. Okay, then what's the next condition that you're going to allow for? And what's the next condition? And that's why this slope is true. The slippery slope is a true problem that Ken has got into now. And we can't even we can't even look and put a step down, which we've done, because it's been disastrous.
There was one over here.
So the question is, do doctors have to still state this Hippocratic oath? I did when I graduated, like, I don't know, 7 years ago or something or other. But now that Hippocratic oath is not spoken the same way, and a lot of medical colleges don't even use it. So the Hippocratic oath says, I will do no harm, I will not give a poison, that sort of thing. But a lot of medical colleges don't even do that anymore. Yeah.
Was there another one over here somewhere? Oh, yeah.
So that was one of the questions that we asked, wasn't it? So what do you think? Well, I can tell you what I think. I think our laws for MAID are very lenient, right? And I'm guessing the laws in California, where there's 10%, 10 times less deaths, they're probably more strict in terms of criteria for what, and maybe doctors are more strict. And yes, you do qualify because you have metastatic advanced disease. I get a sense here in Ontario that if two doctors agree, two nurse practitioners agree for whatever, they'll just like, okay, yeah, made them, and they'll doctor shop, right?
I don't remember which of these books it is. I think it might be this one here, the one on Between Life and Death, but talks about in the U.S. and it talks about the restrictions. And I remember as I was reading it going, that's a lot more restrictive than in Canada.
Right. And I think so yeah, the comments about social medicine, for sure, and maybe that comes down to money, right? Because we're saving money by killing people off, which is a horrific thought. But I'm sure it plays into somebody's head at government level, certainly at the family level. I'm sure it factors in. Nobody would say it, but true.
Mm-hmm. Yeah, my approach to that, brother, would be Romans 14. In your conscience, this gift of conscience that God has given to each of us. If there's a clear directive that you're being asked to be broke, she's not doing MAID, but she would have to follow her conscience. The conscience is a gift from God to assist us, and if we can't act in faith, we shouldn't do it. The Bible says in Romans 14. But I would be careful here because a lot of believers use their conscience to assess other believers. Okay? So we need to be careful here. If someone did choose and they did their best to search the Word of God and make sure they weren't breaking any clear principle or teaching of the Word of God, I would probably lean towards she didn't, and then she's got to follow her conscience in that regard. So, but that's why I said, I actually don't judge that pastor who attended with the hopes that maybe the person would change their mind. That's between them and God. They didn't enable them, help them to do it, but they attended. But I couldn't do it in my conscience. For me, it would feel like enabling, for me. That's more my judgment call with my conscience. And so I think Romans 14 is powerfully instructive in that regard. Yep.
So the question is, this gentleman, he does a lot of spiritual counseling in seniors' homes. And does the family have legal consequences if they discourage their loved one from choosing M.A.I.D? Oh, if you, I'm not aware of any lawsuits in that regard.
I think it would be similar to him if he gives counsel according to his own conscience. He's doing what he believes is in the best interest of his patient. It would be similar for the spiritual caregiver, although you would have to be careful that you weren't in any way coercive.
Yeah,
You would have to be very careful that it was a dialogue, maybe even initiated by the individual, and you could ask questions or that kind of thing. But if there was any form of manipulation, like in your case,
yeah. But it's a great way to bring in your faith into the family as well. And it just, I think to your point, it depends how you word it. And you still want to walk with them no matter what they choose. Thank you for your attention, guys. After that turkey bacon sandwich, nobody had a turkey coma in here, so that's good. So thanks for coming out on a beautiful day.